Hello, everyone. I'm happy to be here. My name is Julian. I work for ATOSS as the lead for AI. My background is AI research. Done that for almost a decade before I started at ATOSS, and I'm usually used to talk at AI conferences, but today, honestly, I feel kind of at home with all the AI talks that we've heard so far, and some great talks we had beforehand. But let's get right started with the talk. First, we're going to look at, well, why should we be looking at AI? I think that's not a mystery to anyone here. How AI is changing workforce planning, and what needs to be considered in practice. But before all that, let's talk about ATOSS. I'm sure nobody has noticed which company I'm working for today. This is our vision, and this pretty much tells the story, who we are and what we do. Let me just read that verbatim. We are shaping the upheaval in the world of work for the benefit of companies, employees, and society. And now the important part, we make it possible to work more creatively, intelligently, humanely, and thus revolutionize the interaction of profitability with humanity. Let me repeat that last part, revolutionize the interaction of profitability with humanity. And if that isn't the perfect fit for healthcare and what the healthcare sector stands for, then I don't know what. This vision has been with us for almost 3 decades now. It hasn't changed. I think it's more relevant today than ever, especially when we're talking about topics like AI and digitalization. But let's look at a few numbers. We have lots of customers in Europe, big enterprises, SMEs, small businesses. Most of them are in the cloud by now, but the number that I always find impressive is that over 4 million employees are using our ATOSS software solution, and all of that is served by just around 800 people. But that's our general introduction. Let's get into the topic of AI. We've heard the topic AI. We've been hearing it for years now. What do we think about AI when we hear AI? Who thinks of something like ChatGPT nowadays? Typically, ChatGPT now, if we're talking to people about AI, that's what they think. AI is such a big field, and I think the term AI itself became sort of meaningless at this point. So we just hear AI, and it's supposed to do some magic that we couldn't do before. Today, I just want to differentiate between generative AI. These would be our conversational co-pilots. These would be our agents, all very interesting and cool stuff that we've heard about today and that can do a lot. That's really an enabler for other technologies. But today I want to focus on something more that's almost called classical AI now, machine learning. I'm not saying that generative AI is not using machine learning. Let's focus on that. And here we have mainly the prognosis, the forecasting, the analytics, all of that kind of stuff that hopefully the agents will be using then. This is really the intelligence behind all of that, because the agents, they're just working on text. They're just predicting the next word. Their real ability isn't in analyzing, it's just an enabler and orchestrator. Okay, but why are we talking about all of this? At ATOSS, we're working on workforce management. What's workforce management? It's time attendance tracking and also personal deployment planning. So answering the question, how much staff do I need tomorrow, next week, or next month? And that's really one of the core questions, because that really helps us plan. And when we say planning, that also sounds fun and nice, but it's really a question of how happy are our employees, how well can we serve our patients as well. So if we don't have the staff there to serve the patients, it's not going to work. We could have the best tools, the best technology to do all of that, but in the end, we need those practitioners there, those experts there, and they need to be at the right place at the right time. This is what workforce management is really about, bringing the people to the right place at the right time. Now, if we look at our environment that we work in, we have increasing regulatory complexity. I think all of you know that way better than I do. We have a patient-to-staff ratio that we have to fulfill. We have the time-tracking EU laws and many more laws that we have to fulfill, and our planners have to take into account when they make those plans. Errors are bound to happen, as we are only human. They have to become experts in that, but still they can make mistakes. With that, we risk a lot of fines. We risk losing a lot of costs, and we know, especially in the healthcare sector, the budgets are tight, so we don't want to lose that money anywhere. At the same time, we have a scarcity of resources. The global nursing shortage is well known. We have also there a demographic shift. People are getting older. We have less qualified people. We have the younger generation coming up that also expects something new. They don't want these rigid processes. They want to have their safety and planning. They want to know next week, can they go to the party of their friend? They want to say, hey, on Friday, I don't want to work late. They want to have that ability. And as a good employer, we have to provide that as well. With all of that, let's look at what we have today when we look at planning. We have our historical data and we have our expert planners. These are people who've done this for years. They know what they're doing. They have this gut feeling of what they're going to plan for, and it works reasonably well. These are really experts. They work on the data. They make a plan and make the roster. And that's been working great. But our environment is changing. It's getting more volatile. And now suddenly all that experience that they've got, that gut feeling that they developed, isn't working as well anymore. And that's where now AI comes in. Because we don't only have our historical data anymore to feel about that, but we make a prediction. We use AI to predict, based on that historical data, a future forecast. Of course, this isn't magic. This isn't anything out of the ordinary. We are predicting the future. It's bound to be off, but at least we have a data-based way to work on. And now we can use the AI forecasted data to make the plan and be much more reliable. And that's all nice and good, but in the end, we have to see and enable one thing, and that is learning. Because at some point, we reach that day that we have forecasted the data in. Now we can compare how well did our forecast fare. In our software, we will show that through these nice free colors, and you can actually compare, hey, on these days it didn't work. Why was it off? Was there an extraordinary event that I have to take into account in the future? Or was this just an anomaly? And not only that, the AI, of course, learns as well, because all of that is new data that makes the predictions better. But why should we be using AI at all? We've heard earlier, also under the guise of AI, we have rule-based algorithms, of course, and these have been working out well as well. But here you also need your human experts that sit down, write those rules, come up with the logic behind it, and it works. However, only as long as the environment doesn't change. As soon as it changes, we need to rewrite those rules, adjust them. It's just not future-proof. On the other hand, we could go more data-based, let's say naive statistical approaches. A simple example would be just taking the average of the weeks before or last week. Works reasonably well, but usually doesn't really catch those more complicated relationships in the data. And that's exactly where AI comes in. As we know how AI works, it learns those patterns, those underlying relationships like correlations in the data, and is able to predict and make much better forecasts, optimize our decisions, and get us better results. Now I want to get a little more technical. Don't worry, I won't get into the mathematics of all of that. But let's see what machine learning is really about, what it really looks like. And we start on the left side. There we just have our data. Those, in our case, for forecasting, is just a time series, let's say, of the patients' numbers of the last couple of weeks. We begin with exploratory data analysis, which is a fancy way of saying we are having a look at the data and try to see some relationships in there. We prepare the data and clean it up. All of that is very important because data quality is one of the key things that we have to push for. Bad data and we'll get bad results. So it's really about not only having the data, but making sure the quality of our data is good. Next, we split the data into training set and test set. That's all very technical, but essentially it's the same as giving a student some material to prepare on, some test questions, but giving it some other questions in the test then later on to be sure they didn't just learn the material by heart, but they actually understood what they are talking about. The same principle here. But now we get to the core, the machine learning part. Who knows how machine learning actually works under the hood? Raise of hands. Few hands. That's already more than I see at most conferences. That's very nice. The basic idea, and this really helps in understanding what machine learning and AI is really capable of, is rather simple actually. We just have some parameters that are being adjusted to make that more grippable, to more understandable. Let's think of something back in school. We just have a line in space. It's 2D. We have two parameters. We can adjust how steep the line is, or high up or down it is in our graph. Those are the two parameters that we are adjusting. Now we have some points, some data points, and we want to adjust the line so it fits those data points. That's all machine learning is really doing. Just with lots and lots of these linear functions that are combined in different ways. But that's every time you hear machine learning. That's the same for our forecasting model. It's the same for the line. That's the same for generative AI. Generative AI, the LLMs, they're just predicting the next word. You give them a sentence, the Eiffel Tower is in, and it's just supposed to predict the probability of the next word. Here, that would probably be Paris, would be the highest likelihood. Maybe then the next is France. But that's all that's happening. And let's just take a moment and think how amazing it is that this simple concept, and this simple idea gives us things like ChatGPT that actually feels to some like a human, where people at Google quit their job because they thought, hey, this system is actually alive. This is a living system when it's just the next token or next word predictor. That's how far we got. But still, keep that simple idea in mind. Every time you hear machine learning and people try to tell you what it's capable of or the magic that's happening behind it, because you always need that data. You always need a mathematical way of telling it, this is what you need to optimize for. If you remember that, then for 90% of the use cases that people come up with and tell you, okay, this magic AI will be able to solve this, you can already say, okay, is this really something that could work? After that, of course, we evaluate everything, make sure it works. We choose the best model. We train multiple models at the same time and choose the one that works best in that case. But how does the AI prediction actually look like? I've talked about patterns and all of that. Here we pretty much see a pattern in the data. We have ups and downs. That could be seasonality. Let's say we have the flu season. There we usually would have some more patients due to that. We might have some more patients after some events like holidays or something like that. The AI would be able to see that in the historical data and predict, okay, likely that's going to happen in the future as well. And that's exactly what it's doing. It's just continuing the pattern that we see in the past. That's, of course, very much simplified, and it's taking into account a lot of variables. It could be taking into account the current weather situations and other external factors, and factoring all of that in, something a human planner couldn't do. But what does it look like in our solution? Here we have a screenshot of the ATOSS software solution of one of our duty scheduling plans. And at the top, you see the patient numbers. Those are predicted by AI for the entire month of March here. So we would be seeing for the 9th of March, we would have 27 patients in this example coming up. And below that, the care expenditure with that. Based on that, we could make our plan and see how it works. But remember what I talked about earlier? This isn't all, because the real magic happens here. We can then, when the time comes, compare how well did this actually work. We see at the top the actual patient numbers, and below that our predicted numbers, and then one line below the difference between the two. So we can immediately see the cases where, okay, it's green, we just are 2 off, of course. As I said, this isn't magic, it's reasonable prediction. But there are also cases where it was too far off. And here we can really have a look. These are our opportunities for learning, our opportunities to see why didn't it work. Was it missing, for example, some information that it didn't get? So the next time I can talk to my sales representative or customer representatives to say, hey, we need more of that data in there to make the predictions better. Also, if this is another extraordinary event that could be predicted with the data, that will help the model in the future improve. So the more and more we use that model, the better it gets over time. So I think we were able to see AI is the best solution for that use case, because especially of that continuous optimization that we have. We can avoid the penalties because software is taken into account all these laws, all these regulations automatically, can save costs, and overall we can increase efficiency and compliance as well. So the question shouldn't be if we use AI anymore. I think you've all understood now how does AI work. We've been working with it long enough. It's when we start using it, because the earlier we start, the better our gains. With all of that, we get a clear path to success, I would say. But in practice, we have to take a few steps to get there. We have to talk to our people. We have to enable them. We have to tell them, be courageous and use these new tools. We've seen today a lot of examples where people were courageous enough to implement agents, to implement AI solutions, and it worked out well. But we also hear enough examples where it doesn't work out well. So we shouldn't go in there blindly. We should manage our expectations. I just read yesterday a case from Deloitte, for example, one of the big five. And they had, I think, a case for almost $500,000. And they essentially produced AI slop. They had a lot of sources in there that were hallucinated. And that's something from such a big company can happen to any of us as well if we're not careful and just trust these things blindly. So we should take care to get this right and not just throw it out there and use it. And the point that I also talked about is the data availability and data quality. That's something we have to take care of. If we look at the reality, we've been talking about AI, we're talking about digital healthcare, making everything better. But when we look at the reality of our customers, we're happy if they're using Excel and they're not writing everything on paper anymore. We have to get them there. We have to enable them to get there to make all of this happen. And if we have all those points in place, then we can start continuously improving, continuously learning, because our first solutions, our first tries on this won't be perfect, but with time we can improve and get better. And that brings me to the end of the talk. Thank you very much. Feel free to get in touch with us here. We'll also later have a roundtable and talk about how AI can impact your work and in healthcare. So let's join us and talk about AI, as that is my favorite topic.